Good morning. I'm Ed Ullmann from Wellness RX. Today, we will ask the question, is society getting its money's worth spending 18% of our wealth on healthcare? That's $11,000 per citizen a year, or 100% greater than we spend on our total educational budget and national defense. 100% more than those two combined, and it's by far a much higher percentage than any other nation in the world. Let's first look at our accomplishments spending this amount of money. Without question, we have some of the world's greatest healthcare systems, like the Mayo Clinic in our country, and perhaps throughout the world. People come from all over to these very, very prestigious health systems. We can do remarkably well with high-level surgeries to keep patients alive. Our transplant programs are really second to none. Just last year, my wife's brother had a double transplant of a heart and lung down at NYU in New York City, and the experience was excellent, the service was excellent. That is really American medicine at its best. We've created some game-changing pharmaceuticals, including the most recent COVID gene vaccines. We introduced advanced high-tech diagnostic costs and robotics at a very high level. I think we're doing a pretty good job handling emergency medicine in this country. And we are successfully delivering lower outpatient services that are generally well received by the public. I also think that the training of our healthcare professionals in America operates at a very high level. Our hospitals, interesting enough, have become very highly efficient at hospital discharges, and part of it is because they're being paid on a fixed fee per admission. And so we have seen that efficiency. And you know, coming from my field, I have seen many of the older health maintenance organizations, or we call them now managed care organizations in the West, where most of the individual doctors are on salaries. I see them getting really high marks for producing an efficiency as they combine the responsibility of delivering healthcare with ensuring the healthcare and with good satisfaction. So I see models of how we can do it. But when we look at things, what do the outcomes tell us? You know, 18% of the wealth, what are the outcomes? Let's start with what we all want: longevity, or the ability to age gracefully and with dignity. And while we are living to an average age of 78.8, women a little longer than men, you know, according to the New England Journal of Medicine, we now rank a cold 36 among industrial nations for life expectancy. Ooh, not very impressive. And this challenge of life longevity is going to be a bigger one now that we have 750,000 Americans who have died by COVID. We have escalating suicides in our nation. We have escalating domestic violence, especially during COVID. We have escalating homicides in our country. Just look at the facts. It's ugly. We have escalating drug overdoses, especially that fentanyl has been coming into the country and being laced with heroin and other narcotics. And we have escalating chronic health conditions that we have to attend. So we're going to probably remain at best with a flat longevity, even though we are going to see modern medicine with gene therapy and so many ways to improve longevity. So this is a real delicate balance. But when I look even further, what are we getting for this spending? I don't think anyone is cheering on the way that we are handling long-term care in America, and that our infant and maternal mortality rates are just simply embarrassing. I don't think that many Americans know that more women today in America die at childbirth or experience serious injury during childbirth than any other developed nation in the world. This is really tough. We have great technology to keep premature infants alive more than ever before, but we are doing a terrible job in keeping maternal death down, and it's worse if you are a minority mom. We got to do better than this. And then we got to be frank with ourselves about the American lifestyle. You know, we live a very high-paced type of an existence. We are looked upon as a wealthy country. We are very, very prone to social media and Hollywood and so on and so on, and we're always on the go. Well, what does that lead to? Well, America now is a world leader in dealing with anxiety, with depression, with sleep deprivation, and pain management, and obesity. It's a fact that 66% of Americans are now reported to be overweight, diabetic, or pre-diabetic. And listen to this, Americans eat 90% of all the opioid drugs produced in the world. So when you see oxycodone and you see hydrocodone and when you see these very, very powerful medications for pain that are all opioid based, understand that America has 90% of them. Oof. Okay, so the first question that we ask is then, do we have a disease-based healthcare system in America, or is it a wellness-based system? Well, I think we all know the answer to that. I don't think we like that, but that's the truth. And then we go to our next question I want to know is that we have had a strategy in America to use market forces. We're a capitalistic society. I'm a proud capitalist, so I have no problem with market forces from most of our economy. I'm not quite sure it works so well with healthcare. And we ask these market forces to design and manage our healthcare system for both cost and quality. And we then have to say, is this the best that we can do? What's the outcome from that decision? And this strategy has clearly led to unabated consolidation in the industry. More power now is in the hands of few companies in every region of America. All right, just check and see what has happened. And there's a big mismatch between the delivery of services in rural America versus urban America. And there's a lot of outcomes that come from that. But the one question that hits me in the gut is one that says, are we paying healthcare providers across the board, from hospitals down even to primary care physician, based on society's needs? Or are we paying based on demand created by healthcare professionals? Not that there's any dishonesty or immorality, it's just the way the economics have been set up. And therefore individuals will take advantage of the system. So let's ask yourself that question, and it's a big one. So here are a few examples that kind of gets us to understand the dilemma of this whole issue that we have. And let's start, before we talked about America, without anything around the world, it has the highest tech diagnostic services for our citizens. And this access clearly has helped providers with better decision making, and that's great, but it comes at a high cost. In the United States, we have twice as many MRIs and CAT scan machines than any other nation, and we have 3 times as much as Canada. Now that's a lot of excess capacity of diagnostic machines. It could be good, it could be bad, but it's costly. And since 88% of our physicians are specialty trained physicians, and put that into a context, England has 73%, we have 88%, 73%, and Canada has 52%. So what you're going to start to see when we look at those numbers is that other nations put a higher priority on lower cost primary care services, less on the specialty. We, as our systems develop, have put a much higher premium on specialty medicine and less on primary care. But when we do that, understand our system will have a greater dependence on high cost technology services. Look, another one, consolidation or mergers and acquisitions among hospitals and health systems and medical groups throughout America continues at a record pace. That's part of the economic system of market forces that leads to that. All right, but on a positive, this has led to America having fewer acute hospital beds per capita than any other nation. So when you look at this consolidation, whether we have got rid of underperforming hospitals in rural America or underperforming hospitals in urban America, however it might be, the end result is that consolidation has led to less beds that are available for citizens. That could be good. And we then look at all right, is this consolidation that we're having, is it leading to better outcomes? Is it leading to cost savings? That's what all the proponents will tell us. That's why we're merging. That's what America does. Economy of scale, and we can deliver. Well, according to the Healthcare Association of New York State, 60 to 80% of all mergers fail to deliver on their expectations. So in reality, what happens is prices have instead gone up. That's the truth. And then let's just look at drugs, my background. All right? Access to pharmaceuticals is important to Americans. And Americans take more prescription drugs than most any other nation. But we in America pay over twice as much for prescription medication than any other nation. Whew. We have all these pharmaceutical companies, we produce them, and we pay twice as much. And we don't have legislation that allows for our purchasing of drugs from other countries and so on and so on. So that's the facts. We pay a lot of money, and this is in spite of that 83% of prescription medications right now are low-cost generics. All right, put it into a context. 83% of low-cost generics, so all of the monies related to higher pharmaceutical costs are coming from 17% of brand drugs. All right, helping to drive this demand for medications is the fact that America and New Zealand are the only two nations in the world that allow for direct advertising of prescription medications to the consumer. Well, more advertising, more demand for drugs. It's just the way a capitalistic society operates. What has this led to? That drug advertising now accounts for over 30% of the annual revenue streams of our traditional television stations like CBS. They're trying to compete against cable channels. So that revenue is important to keep them in business. Might say this is a kind of form of codependency, huh? So while pharmaceutical companies, they claim, and this is the thing, that we need these higher prices because we do so much research and development, which we call R&D, in order to produce the new drugs for tomorrow's Americans. We've done a great job at that. It seems reasonable, but what's the truth? The truth is the R&D budgets for pharmaceutical companies in the United States have gone down by 50% over the last 20 years. And of course, if you're spending less money on R&D, and we have continuing increase in R&D from the government to help the pharmaceutical companies to make high quality medications, right? That's a good example of Moderna vaccination. All of the money for Moderna came from the government, produced a good vaccine, and that was the first product that they brought to market. So there is a partnership that occurs between the government and our private pharmaceutical companies. But when we look at it and really drill down, what is happening here, and it just doesn't smell good. And that's the type of questions that we have to look at as we go forward. So as we can see, the issue of whether or not we are getting our money's worth spending 18% of our wealth on healthcare is complex. Now, if solutions are going to be tough, and then the reason why that's even more challenging is that 11.5% of American jobs today are related to the healthcare system. 11.5%. And every projection for the next 10 years is looking to healthcare jobs as being the number one driver of new jobs, of new occupational based jobs in this country. So you can see there's another codependency that occurs with the healthcare industry. To me, here's what is clear. The American healthcare system is driven by high cost fee-for-service medicine and not value-based medicine. And you provide a service, you get paid under a fee schedule. All right. And it valued that over low-cost primary care and preventive medicine. And that's the best way that we can look at it. We've been talking about this issue for over 30 years, and here we are today again. And probably the problem is probably greater than it was 30 years ago. We have to understand that our structure of this healthcare system leads to the highest administrative costs of any nation by far. And oftentimes we might see up to over 15% of a budget being spent for administrative costs. It's a lot. And defensive medicine is alive and doing well. Providers got to protect themselves since all the lawsuits that can occur, and therefore they are trying to do best they can, and therefore they have to have a defensive medicine order the test and stuff to be able to protect the case, to prove what they did was rational and needed. And in the end, our system must demand more accountability for spending. We have to show that when you do have outcomes, what does it show, and make adjustments accordingly. And as we push into changing reimbursement systems in the country based on performance, what you do, you should perform at a higher level, you should be paid more. We've got to have a system that's consistent throughout the entire nation. So we have a big challenge. In our next module, we're going to try to talk about some of the tensions that occur within the healthcare system and why it makes it more difficult to make change. Thank you today for spending another time out of your schedule to listen to our module. Have a good day.